And Christina, I know we had your anniversary a while back, so it's been about a year and a half.
Yeah, a year and a half. Yeah. Yeah, and
Um,
this summer it's gonna be, I think, 2 years. Yeah.
Tell me about your life.
So I'm back at work. I'm back at school. I decided to go back to school as well. I think you guys see I train a lot now. I like to get my body as strong as possible. That was like on my bucket list. As soon as I got better, I wanted to be the strongest I ever was. So I'm constantly working on that. And yeah, that's pretty much it. It's been a really jam-packed schedule, but I love it. I love it so much.
So, Christina, do you live carefully? Are you worried about injuries, or are you just living?
No, no, not at all. There are some days that are worse than others. There are some days that I get neurological symptoms, but I think having that fear of, oh my God, is it gonna come back? Oh my God, am I gonna be in pain? I think having that will just limit you. So I live the fullest that I can, and I listen to my body. If I'm really not doing well, I won't do certain things, but I try to push myself as much as I could. But I think it's important to listen to yourself, listen to your body, know your limits. But as for having that fear, no, I don't think that's how you should live life. I think you should go out there and put yourself out there and do the craziest things that you want to do. And yeah, it's not easy. I think you have to have some sort of mental fortitude, but that's how I live my life.
So, Christina, if you could give advice to someone coming through this program, I think you're one of our patients where you didn't want to talk about it too much. You're not on any of the groups. You just wanted to get back to life and put this behind you. But if I could ask you to look back for other people going through this, saying, it's just too painful, I don't think I can do it, what would you tell them?
As someone who's tried many things to try to, get better and fix my CRPS or go into remission, I think it's really important to stick to something and push through it. Especially the program that you guys have. It's an amazing program. Like I said, I tried many different medications, many different treatments, natural, medical, and nothing worked. What really worked was, the clinic. And like I said, is it going to be rough? Probably. Is it going to suck sometimes? Probably. But you have to just stick to it. Know that there are many people who've gone through the program who have successful results. And like I said, you just got to push through it and know that eventually your life will come together and things will get better.
Christina, your life makes me so happy. Shining example of just horror. I mean, the horror that your life was, and now you're just being young and you're beautiful and you're doing all the things and you're rock climbing and weightlifting. How many pounds are you bench pressing now?
Well, I don't bench press. I'm not that fancy, but I do a lot of deadlifts and hip thrusts and squats. I've attempted my most recent attempt at a deadlift was 245 pounds. It wasn't successful, but I think I deadlift around 235 pounds, and not that far off, but yeah.
Well. Oh, it's so good to see you. I wish Bryce wasn't with the patient. I would bring him in.
I know. I haven't seen him in so long.
He said he was so excited to, we're talking to you, but then he had to go in with the patient. So you'll watch the video later. But your life makes me happy. And we'll do another one of these some more years down the line. And
sure.
One of these days, maybe you have different things in your life, like babies, but you're all fun. Your road was here and now you're going this way. And I love it.
Yeah, actually, I would really like to come in January to come see you guys. Hopefully everything works out, just because now with school and everything, it's a bit rough, but hopefully in January, if it's not too busy at the clinic and everything works out, I could come see you guys.
You feel like a celebrity in here.
Oh, my gosh, really?
Yes, a lot of people found strength in your journey because It's bad. It's bad for everybody. Your pain was so bad. It was so bad. And you just had that fortitude, that grit. And you could see it right away. And we never doubted that part. So that makes our jobs so much easier. So
well, that's it. I think is that, like I said, I think a lot of people have this expectation they're gonna come there and it's gonna be, like smooth sailing, but there are ups and downs. And like I said, I think it's really important that you commit to it, because like I said, you saw me firsthand. Sometimes it would get a bit better, and then it'd get really bad again, and then it'd get a bit better, and then it'd get really bad again. But you just have to stick through it, and also have some sort of like small goals as well. I made myself little goals here and there throughout the journey, and if your goal is very vague, like, oh, I want to be at 100% remission, obviously that seems unattainable. But if you have these small steps, like, okay, today I want to slightly bend my knee a few degrees, or put my foot down on the floor, or feel some sensation in my foot again. I remember those were like the small goals that I had for myself. And each time I met the goal, it pushed me to go further and further and further. And because I remember my first thought coming into the clinic, I thought I was going to be in the wheelchair forever. I thought I was just going there in hopes to reduce some of my pain, not necessarily remove all of it, but I thought I was going to be in the wheelchair forever. I didn't expect to get out of it. So once I saw my small goals being met, and then I made my goals a bit bigger, and here we are now.
Back to life. Did you leave your wheelchair here in the US?
No, I had to bring it back because here it doesn't really belong to me. It belongs to the government. So I have to give it back to the government when I'm done. But even when I brought it back, they were like, are you sure you don't want to keep it? I'm like, no, take it. I don't want it anymore.
Take it.
Yeah. I was like, just get rid of it. I'm done with it. I don't need it anymore. So it's nice.
Thanks for doing this. You made my day.
Yeah, no, I'm really happy to see you guys. And honestly, I can't wait to come back and see everyone, and hopefully give a bit of motivation to everyone that's there in treatment.
Yes, definitely. We'll have you do a little lecture for everyone.
Yeah, I would love to. Yeah, actually, I talk about it all the time. Like, actually, the program that I'm in school. I'm doing I'm learning how to make prosthetics. So I bring my subject up a lot, and people are so fascinated by the clinic and fascinated by CRPS because it's such a rare, disability. Not a lot of people know about it. So it's really cool talking about it. It's really cool talking about the clinic. I show them videos all the time of patients and what you guys do at the clinic. So it's really nice.
Thank you for doing this.
Yeah, no problem. So I guess I'll talk to you guys soon.
Maybe January. That's exciting. Kaylee's off here.
Yes. Bye, guys.
Bye.
Love you guys. Bye.
Bye. Bye.